Hello, Trojans. Welcome back to another lesson of online learning. I'm sorry for the delay in the lesson today. I've been having some technical difficulties, so I've had to do the video a couple times. This week, we're going to do more of a PowerPoint presentation, so I won't have my TikTok videos in there, but I'm sure y'all will survive. So this week, we're talking about immobilization and splinting. Let's start off by what is a splint. So a splint is a rigid or flexible appliance used to maintain a position and protect an injured body part. Example of this, let's say someone fractures a bone or they break a bone. We would want to use the splint to stabilize that fracture and ensure that that fracture does not become worse. Or let's say someone dislocates a joint or the bones are not in its normal position of the joint. We will want to maintain a normal position and protect the injured area. That way the dislocation doesn't get any worse. So in the picture, you could see that a splint here is made out of some cardboard and just some tape. Just based on the position of the splint, this person could have possibly fractured their tibia. Maybe they fractured their fibula, or they could have dislocated their ankle. We really wouldn't know unless we did a full evaluation. So now that we know what a splint is, when are we going to put a splint on? So we are going to put a splint on if someone has a fracture or they have a broken bone, if someone has a dislocation or the bones are not in the normal position of the joint, if someone has a very severe sprain, like a grade 3 sprain, meaning it's completely torn, or a tendon rupture, again, meaning that it's completely torn. The difference between sprains and severe strains like tendon ruptures is sprains is an injury to a ligament, and we know the ligament attaches bone to bone, and then tendon is an injury to a strain is an injury to the tendon, which attaches the muscle to bone. So if those are grade 3, we want to splint. For instability, if they feel really loose, significant lacerations. We went over lacerations when we were looking at wound types, and laceration was a jagged cut. We could stabilize it and make sure that the wound and the cut doesn't open up more and get any worse. And then just when in doubt, you would want to splint. It's not going to hurt them if you apply it correctly, so it should only help them. In this picture, out of these injuries, which one is this? This is kind of funny because this makes me think of like Dora the Explorer when she's like, where's Swiper? Or, where do we go? And then she just pauses and hopefully you answer. I'm sorry if I'm super Dora Explorer status, but, we're not in person. So this is kind of how we have to do things. So yeah, I hope you said fracture because this would be a broken bone. This bone right here would be the thicker one of the lower leg bones. This would be the tibia on the medial side, and that would mean this would be the fibula that is broken. This one is a little more vulnerable because it's skinny and it's fragile. Remember, fragile fibula and thick tibia. So that is a fracture of the fibula that we would want to splint. Sorry, let me turn off my alarm real quick. See, all these interruptions. Gotta love distant learning. So why do we splint? We want to splint to prevent movement of bones, wounds, and or joints to reduce further injury. If we prevent movement, then we could decrease the chances of that injury becoming worse. We also want to decrease pain because usually when someone becomes injured, movement hurts. So if we are able to stabilize and immobilize them, meaning like they can't move, then it's going to help decrease the pain. Also, to prepare them for transport. So let's say that they need to go to the emergency room and they are going to drive in a vehicle, maybe, a parent's taking them or they're riding in the ambulance. We want to prepare that person to get in a vehicle, driving, and everything's bouncing around, and the streets in Chula Vista, there's all these potholes, and you don't want you just don't want to increase their pain. You want to help stabilize that, prepare them to get in the vehicle. And lastly, to minimize complications in the muscle, nerves, and blood vessels that can become damaged. So if we're looking at this picture here, we have a closed or simple fracture. This bone, what is this bone? Is the longest bone in the body, attached to the pelvis in that makes up the thigh. That would be the femur. So this is a fracture of the femur. It's starting within the skin as a closed fracture. But let's just, for example, say this person's moving around and they're getting improperly splinted and that bone breaks through the skin. And that would now become an open fracture. So we did not reduce further injury. It just kept going and made it worse. And now that we have an open fracture, now we probably have nerve damage, blood damage, and obvious muscle damage. So that is what we're trying to prevent with splints. So splinting guidelines. Splint in the position you found the patient in. You never want to move them around because you can make things worse. So wherever, however they're laying, you splint them in that position. Sprint prior to moving the patient, that kind of goes with the first point. You don't want to move them first and then splint them. Like, let's say they're on the court or the field and you just need to splint them on the court or the field and then move them to the sideline. But you want to make sure that you immobilize that area to make sure that the injury does not get any worse. Then you also want to splint above and below the injured area. So let's say if someone gets injured on their radius, we don't want to just splint that little piece that's fractured. We want to go above and below to ensure there's no movement and no chances of that bone moving around. And if applicable, hold extremity or hold the arm, leg, whatever it is, in place until the splint hardens to the desired position, because there is some splints that need some time to harden before you have them moving around, and that way it maintains that position. So a couple other things that we would need to check. So you want to check PMS, distal to the site of injury, distal meaning distant, meaning away from the injury and away from the joint. So if the injury is here on the tibia or fibula, we will be checking PMS down here towards the foot. The proximal end would be towards the knee. So you want to check that before and after splinting. PMS stands for pulse, motor, and sensation. So you want to check their pulse, make sure that they have circulation going down the extremity. So here you could see that the injury is going to be the lower leg, so he's checking the pulse in the foot, which is what we call the dorsal pedal pulse. Then you want to check their motor sensation. In this injury, I would just tell them, can you wiggle your toes? So motor being able, can they move? And then sensation, I kind of just would rub their toe a little bit. It's kind of weird, but you rub their foot, be like, can you feel that? And if they say yes, then cool. If they say no, you want to note that and let the paramedics know or the doctor know, whoever is going to the next step. So you want to check that before, and then you want to put the splint on and also check it after. Also, if you have any kind of like open fractures or wounds, you want to cover all wounds with a dry, sterile dressing before applying the splint to make sure you reduce the chance of infection. All right, so some complications that can occur with splinting. So you could compromise circulation. Let's say that you checked PMS, you checked pulse motor sensation before, and then you put the splint on, and you check it again, and now you can't find a pulse. What could have gone wrong? Oh, did you say you put it too tight? Yeah, so if you put it too tight, it could compromise the blood vessels and the nerves, causing them to go numb or lose sensation. So if that's the case, that's fine. It's okay. Just loosen it up a little bit. But at least you know. But you won't know that unless you check PMS before and after you're putting the splint. Then compartment syndrome can occur. That's when it's wrapped too tight and compression or movement of the nerves, tissues, and blood vessels by the splint cause more new injuries. So compartment syndrome is basically too much pressure in the compartment that is going to typically cause numbness, tingling, and poor circulation. And also delay of transport for life-threatening injuries. Let's say if you're splinting someone very, very slow, and the ambulance is already there, it's just delaying the time that they could get to the ER. So this is something that you would need to practice if you were ever going to go into like EMT, paramedic, athletic training. That way that you're doing this in an efficient and timely manner. So now I want to talk about some common types of splints. This one being the vacuum splint. This one is pretty expensive. You won't really see it in the high school setting. You mainly see it in the college and pro setting, but it's really cool. It's a larger splint. It's usually used for like upper arm or arm injuries, leg injuries. A large splint that forms to the joint by taking air out. So if you could see this little kind of valve, you hook a pump up to it, and you just take the air out, and it forms to that injured area. So it can adapt to any joint position or angulation, which is great because you want to splint them the way you found them and splint them how the joint or the bones are when you found them. It may interfere with the ability to assess the distal pulse just since they're so bulky. Let's say they fractured their radius here. It'd be a little bit hard to get the radial pulse down by the wrist. So just ensure that you put a little space so that you could reach in there and find the pulse. Super cool splint, but not something that we see in our setting. So next thing is a sling and a swath. A sling is a triangular bandage or prefabricated sling, and a swath is a cloth or ace bandage that holds the patient's arm against the body. So we can see here the darker blue would be the sling, and this fabric going around his body would be the swath. This is going to provide stability to a upper extremity injury. So let's say someone dislocated their shoulder or fractured their clavicle. We want to ensure that's not moving around, that shoulder joint isn't moving around, and we're preventing injury. And we just splint them by using a sling and or a swath. Hopefully when we get back to school, I could just show you how to make one really quickly, but who knows when that's going to happen. Next, we have a SAM splint. SAM stands for structural aluminum malleable. It's very lightweight. It's highly versatile. As you can see in this picture, you can use it for just about anything. And it's also reusable. It's waterproof and it is affordable. This is what we are going to see in the high school setting. If we need to splint someone, usually SAM splints is what we are going to bring out because you can reuse them. They're pretty affordable. So let's say I splinted someone's forearm here, sent them to the ER, they could get an x-ray through this splint and just bring it right back. But even if they did keep it, it's not much of a loss because they're pretty affordable and way less expensive than a vacuum splint. So this is what we use in the high school setting. If we were at the high school or if we were in class, I would have you guys practice applying these to a partner. Next is alumifoam. Alumifoam is usually used for fingers. It's a foam laminated aluminum splint, so you can see the foam on the inside to provide cushion, and then the aluminum outside to provide protection. So you could trim it to fit the finger, because everyone has different size hands, and then it cushions and protects via the foam and the aluminum. Typically, again, used for fingers. Like jam fingers, broken fingers. What is the anatomical name for the bones in the fingers? ... Dun, 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 dun. And that is phalanges. Phalanges is the correct answer. Ding, ding, ding. You win $1 million. So next splint we have is orthoplast. Orthoplast, I think, is super cool. Basically, it's rubbery when it's hot, so you could either put it in hot water or you put it in the microwave. There's like specific microwaves for these things. And then you form it to the joint or form it to whatever the injury is, and then it becomes rigid and hard as it cools. So now you could custom fit this to just about anything. They have some really cool splints, really cool like wrist splints and braces that have orthoplast that you could just pop it in the microwave, form it to the athlete, and then boom, they're ready to go. And then when they're done using it, you could just form it to a new athlete. And yeah, it's reusable. Casting materials. So this is something that you're going to see in the hospital setting. Obviously, you won't see this at a high school. Like, I'm not just over here casting people, but highly versatile. Basically, could be used for any bone, any joint. It's custom fit, adds compression with the ace bandage underneath the casting material. So this should be nice, nice and soft, so it's not hurting his arm here. And it's radiolucent, meaning that they can x-ray through a cast. So let's say that you had the cast on for 3 to 4 weeks and you go into the doctor and they want to do an x-ray again to see if it's healed properly. You don't have to take off the cast and they don't have to put a new one. They just x-ray straight through the cast, and then if it's healed, they'll most likely take it off. If it hasn't healed properly, then you'll just keep it on for a couple more weeks. Some forearm and elbow splints. So this is the sugar tong splint. Like if you had some tongs to take out some cubes of sugar, right here on the forearm and right here on the upper arm. What is the upper arm bone? If you hit your funny bone, your upper arm bone, it's humerus. Hee hee hee. And then we have what's on the thumb side. We have rad radius, and on the other side, the ulna. So this is stabilizing those bones of the humerus, radius, and ulna. Then we have a posterior splint. Posterior meaning it's going on the back. You could even put a posterior splint on the back of the knee. And this is typically going to prevent hyperextension when you straighten out your arm, or even if you put it on the knee when you straighten out your knee. And let's say they have a hyperextension injury, or they fell and they caught themselves with their arm and their elbow straight, that could cause a lot of injuries here in the arm. So that's what we call a posterior splint. So this brings me to your assignment. I know that was a bit of a longer lesson, but I want you to create a splint with the materials at home. So you are doing a DIY splint. DIY, if you didn't know, is do it yourself. I didn't know that for a long time. Be creative. You could use so many things. You could use magazines. You could use cardboard. You can use sticks. You could use bandanas, towels, whatever you can find in your house. This is for you to be creative and use things and just be very resourceful. I want you to submit a picture of your DIY splint, and I just want you to type in what bone is injured so I know that you're splinting the correct thing. So like, let's say if you're splinting a phalange, you're splinting the finger, I want to make sure that your splint is on the finger. If you say that you're splinting the phalange and your splint's on the leg, like the lower leg, then I'm gonna be like, this person doesn't really know what they're doing. So tell me what bone you are splinting, and submit the picture to Jupiter Grades before Wednesday at 11:59. This picture, and don't forget to complete your test before Friday at 11:59 as well. Just a reminder that these due dates are always the same every single week. We will always have an assignment due on Wednesday, and we will always have a test on Friday. And if you ever have any questions, please hop in on our office hours Tuesdays and Thursdays. I send the link through Jupiter Grades. So I'll send the link at like 1:15, and then at 1:30, just click the link and I can answer any questions you have. So this is just some cool splints that were just made out of anything. So, we got some sticks, some poles, some bandanas. They put a little bit of, soft cushion before they put a rigid outer base on it, and then they tied it up some way, somehow. This one's kind of using belts, using rope, using bandanas. So be creative. Remember, you could always just watch this video as many times if you're confused. But if you do have any questions, hop in at office hours. I hope you guys have a great week and keep staying healthy, my friends.